Welcome to the Envision Clinical Case Study Series. My name is Arun Kalava. I am a double board certified anesthesiologist practicing here in Tampa, Florida. I practice both acute and chronic pain in my private practice. We're in downtown Tampa. I would like to present this case today wherein we use CIVCO's novel ultrasound Envision product. This was a 42-year-old gentleman who was a veteran, presented to me with a chronic mid-sternal chest pain following a surgery that was done about 15 years ago to remove a tumor in his thoracic region. He had suffered with this for a long time and had failed opioid therapy. He had a spinal cord stimulator placed, which gave him relief for about a few weeks before he started developing signs of infection, which turned out to be MRSA. In view of this MRSA, the spinal cord stimulator was removed, and obviously the pain returned. He has since been using opioids without much of a relief. When I saw him, he did complain of a lot of allodynia, which was non-painful stimulus causing pain, hyperalgesia, increased sensitivity, skin sensitivity, which caused extreme pain. He usually cannot even wear a t-shirt at home because any contact with the clothes made the pain worse. So the plan for him was initially to perform an ultrasound-guided pectointercostal nerve block targeting the anterior cutaneous branches of the intercostal nerves on both sides because the sternum is innervated by these intercostal nerves. Here in this picture, you see the depiction of how pectointercostal nerve block is performed using an ultrasound probe, which is covered with CIVCO's Envision pad. We place the probe on the chest. In this case, since his chest wall is very sensitive, using any gel would not be ideal, given the fact that application of gel, one, doesn't give me the good grip I need on an uneven surface wherein there is sternum and rib. Number two, the patient's hypersensitivity makes it difficult to perform the block, as wiping off the gel at the end of the procedure might not be very conducive for the patient. So we decided to go ahead use the Envision product by CIVCO in this particular case. The equipment you used that day was a Sonosite linear high frequency probe and obviously the CIVCO Envision ultrasound scanning pad, which we mentioned. This slide shows us the ultrasound image of that particular patient. We performed the nerve block on. If you look at the ultrasound picture, you have from the top skin and subcutaneous tissue. This is the pectoralis major muscle. This is the rib. We're at the fourth rib level. We see the intercostal muscles. Intercostal muscles are between the ribs. And we can see the pleura, which we want to stay away with our needle. The benefits, obviously, of using Envision in this particular procedure are that it allows me to have a very firm grip on the chest wall. As I mentioned earlier, because the chest has uneven surface due to the presence of ribs. We also talked about his allodynia, which can be problematic after and before the procedure, as wiping the gel produces more pain, which can be avoided by using just saline that we use with Envision. So the good news was when we used these nerve blocks, patient had 100% relief of pain immediately after the procedure, which lasted about a day or so, as these were diagnostic blocks. Since the diagnostic blocks were positive, the next logical step for us was to use phenol and alcohol to burn the anterior cutaneous branches of these intercostal nerves. We did the same procedure like we did, as you can see in this video, the actual procedure performed in this particular patient. We used a needle in plane to come into the interspace between the pectoralis major and the intercostal muscle, where the anterior cutaneous nerves traverse, and we deposited the local anesthetic in this area where it would target the anterior cutaneous nerves. You can see the pleura that is moving, so we're away from the pleura, being careful not to damage the lung. At the end of the procedure using phenol and alcohol chemoneurolysis, the patient had pain relief which varied anywhere from 30 to 50%, which was significant for him given the fact that he was in severe pain when he presented. So if you would like to have a free sample of this Envision ultrasound probe covers or scanning pads, or would like to request more information, please call CIVCO at 800-445-6741. Thank you.